When you're working on light cardio activities, what happens is the brain actually releases this special chemical to promote this thing called neuroplasticity. Your teenage child has been diagnosed with functional neurological disorder, short for FND. Does your child need to work with physical therapists? Hi, my name is Dr. Lee. I'm a pediatric health psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get their life back and feel like normal again. Because I truly believe these teens deserve so much better in their lives. So today's video is about teen FND and physical therapy. First of all, FND is an umbrella term to describe these cross-wired problems between the brain and the body when your teen's body and brain are physiologically looking quote-unquote fine. It is a real diagnosis and your child's not faking or doing this for attention. And it's a very common diagnosis you would get in neurology clinics, and it is a biopsychosocial phenomenon. Now, I have tons of videos about what FND is and biopsychosocial phenomenon and influencing factors, so check those videos out. So without going into further details, there are three generally defined categories within physical therapy. One is so-called regular physical therapy, which is focusing on strength and conditioning, sort of like thinking about the gym and working to condition athletes who are recovering from injury kind of thing. And then the second part is the vestibular physical therapy, which is specifically designed for treating concussive injuries like brain injury. And then the third one is neurophysical therapy, which is what we're going to be talking about. That is specifically working to resolve FND symptoms. So the question is, who should work with physical therapy? Well, just about any FND conditions, but especially if your child is struggling with functional movement disorder. Things like functional tics, paralysis, weakness, balance issues, difficulty walking, and things like that. Anything that has to do with the movement, then physical therapy, specifically the neuro PT, if you can find them, is your golden ticket to recovery. So recently, I actually had a privilege of interviewing two, not just one, two neurophysical therapists who are specialized in working with individuals who are struggling with FND, and they shared this golden opportunity nugget with me during the interview. So I want to share a little bit about that with you guys. And one is, across the board, patients who are struggling with FND, that includes your teen child, is encouraged to engage in some sort of light cardio exercise with moderate heart rate. Now, it really depends on where your child is at the moment in terms of the recovery process. So let's say your child has been in bed rest for weeks and months, because of these FND symptoms, then for your child to jump out of the bed and then just go straight to like 3 miles run would be a little too much to begin with, right? So again, this is all about baby steps, but starting with some sort of light cardio activities where your child is going to have a little bit of increased heart rate. And when I say light cardio activities, it could be anything from like walking, bicycle ride, to brisk walk, to light jog, or just play outside and having fun, where you want to help your child to get to this moderate heart rate. The moderate heart rate, aka the light cardio exercise, is going to help increase the blood flow within your child's brain and the body. And there are two things that happened, and that would help your child regulate this autonomic nervous system, which again, FND is all about the dysfunction of the autonomic nervous system. Therefore, anything that would help to re-regulate and rebalance the autonomic nervous system is a good one to do, including this light cardio activity. And then when you're working on light cardio activities, what happens is the brain actually releases this special chemical to promote this thing called neuroplasticity. So it's kind of like a win-win-win situation. So how long does your child need to do that? At the very minimum, it takes 2 to 3 weeks of daily activity to form this new connection within your child's brain. So that is the minimum requirement. However, the longer you do it, the better. And the other thing is, when your child is engaging in light cardio activity, your child probably want to focus on three things. One is attention. The attention is not on their body, but attention is on the external thing that they're doing. So for example, let's say your child is engaging in basketball. Instead of thinking about this mechanical movement of how the arm and then shoulder and then the knee muscle is going to do, it's just easier for your child to focus on, okay, let's just throw the ball, or let's just pass the ball, kind of thing. So the focus is again on the attention. And secondly, this activity if your child has a sense of autonomy, meaning that your child is able to choose among some options to do, that would be so much better instead of other people telling your child what to do. So this is exactly what I'm talking about, the two ingredients that your child absolutely have to resolve teen FND. One is a sense of empowerment, feeling like they're in control. The second one is a self-awareness, not just about the symptom is about to happen, but let's focus on the empowerment here. So the same thing here with the light cardio activity. When the child has an option to choose to engage in this activity over that activity or doing this particular activity now versus later, like 10 minutes later or 30 minutes later or later in the day or whatever that is, and then let the child choose, then the child has a sense of responsibility, ownership, and then autonomy, which is going to help towards the resolution of FND. Now, that doesn't necessarily mean just because your child is picking one activity over another doesn't necessarily equal instant resolution of your child's FND symptoms. So just so you know, okay? So that's the second one, the autonomy. The third one is have a meaningful activity. So let's use example of this basketball. Once again, instead of doing this like a boring mechanical movement in the name of resolving your teen's FND, which can be so boring and then disengaging and not sustainable for your child, it's much easier for your child to pick something that is meaningful. Let's say your child wants to go back to basketball or volleyball or softball or swimming or track, or anything that you can imagine that your child can be excited about, that promotes the fun and joy and motivation. That is so much better than doing this boring mechanical movement. All right, so just to recap, attention is external instead of the internal, and then there's autonomy among the child, and then any movement or physical activity that your child is engaging is meaningful. All right, so just focus on these three things. 2 to 3 weeks, right? And then light cardio activity. Again, it could be just about anything that is moderately increasing heart rate level, because it's going to help promote the recovery all around for your child. So what can you do as a parent? Well, first of all, let's just make sure that your child's FND is indeed the diagnosis that your child gets, right? And then it's really important for you as a parent to know what FND is, instead of pushing aside this potential diagnosis and then trying to go into the rabbit hole of, no, there's got to be something else, while ignoring this diagnosis of FND. Now, speaking of, if you want to know more about FND and how you as a parent can help your child towards the recovery of FND, then click the link below to go to my website for a free webinar training. Also, leave a comment down below what kind of physical activities or what kind of physical therapy that your child has been working on and what was helpful and what was not helpful. I would like to know. So let's engage in a conversation. Thank you so much for watching this video, and I will see you in the next video.